so we found out that I was going to be the chief medical officer and start my position on August the 1st
Okay.
of last year, 2022. And my wife and I found out that we were pregnant later that month. So I don't think that was ironic. I found out later it was divine. And, it began to, first of all, before she actually found out that she was pregnant, she was having a lot of problems, a lot of nausea, a lot of vomiting, different things like that. And she didn't think she was pregnant. Matter of fact, it didn't even come up from her. So I had to ask her about it. And of course, she was like, no, of course not. Now, we really were focusing on a lot of career ambition goals. We weren't even thinking about pregnancy because in our mind, like she is the CEO of a clothing company, so she was preparing to expand and do a whole lot more. So it just wasn't even in our mind. And I was taking on this new position as chief medical officer, knowing that I had a lot of tasks coming up that I was going to be overwhelmed with. So it was kind of like out of sight, out of mind. But long story short, after a few weeks of her having symptoms, she went and got tested and found out she was pregnant. And so she had already begun to have symptoms early on. A lot of these symptoms are not uncommon in someone who is pregnant, starting out as far as morning sickness.
Okay.
But despite seeing her doctor, who was great and awesome, she still was having trouble. She was given medications to be able to try to help and giving this and giving that. And despite all of that, she was still having problems holding things down, requiring some hospitalizations and ER visits early on, getting IV fluids, hydration, getting anti-emetics to help. And despite that, she was having issues. Our prior pregnancy was 5 years ago. And at that time, my wife had 7 visits to the hospital. So
Okay.
going to the hospital was not something that was uncommon to us, but we had no idea that over time she would have a total of 23 visits to the ER/hospital. So earlier on, it was just kind of like, okay, well, this is part of the process. She had rough pregnancies. 5 years ago, had a total of 7 hospital stays. We got through it and moved forward. And I will state that in that last hospitalization, it was the first time for me as a clinician to really like see postpartum depression and what that looks like. So even as a physician, I still was somewhat oblivious to the significance of behavioral health in the scope of pregnancy and postpartum. So it was a learning experience, not just for myself, but her as well.
Yeah.
Because initially, she was not thinking that she was dealing with any behavior health related issues as far as postpartum depression or anything like that. She just thought it was the process that comes along with pregnancy. And, unfortunately, we see this a lot more pronounced in the Black community. So, talking about this is something that we need to do more of. And when you look at the maternal mortality in populations, especially those impacted communities, there's a lot of overlap with behavioral health. We started out having more typical problems that are associated with pregnancy early on, as I alluded to, as far as the morning sickness, the nausea, the vomiting. And then she began to have a lot of abdominal pain, which she had extensive workups, and turns out that this was discomfort that was associated with pregnancy. All of the workup, gallbladder, all that other stuff come back fine. But to the population of providers that was taking care of her, it just appeared to be very, very early. And, as we talk about kind of like a plan going forward, as far as, providers, whether it be paramedics or whether it be emergency room providers, or even some OBs, it's important to be well trained and aware of the uncommon presentations that women that are pregnant, may deal with and may present with, because there's a lot of studies that kind of show dismissal of the concerns of moms and how that plays a factor.
Yeah.
So for my wife, it got to a point where there were times where she did not want to go to the emergency room. She did not want to go to the hospital because there were experiences where she felt as if she was not being adequately heard. Now, this wasn't the case all the time, but she had some experiences, unfortunately, where I had to intervene and say, hey, rationally, does that make the most sense for you not to go if feeling bad? So her experiences with, a healthcare system where she didn't feel as if she trusted it was not something that just started with this particular pregnancy. It started even before she met me.
Okay.
And this is the mind frame of a lot of individuals, regardless of race, socioeconomic status, that I have seen in the time that I have been a physician.